beg to move that this House do now adjourn.
The question is that this House do now adjourn. Dr Danny Chambers.
Thank you, Madam Deputy Speaker. I appreciate this opportunity to speak on a matter of urgent importance: the shifting landscape of global health policy and the direct threat this poses to public health security in the UK and worldwide. In recent weeks, the United States has announced its withdrawal from the World Health Organization, significantly scaling back its support for major global health initiatives. It has also curtailed the activities of key institutions, such as the National Institutes of Health and the Centres for Disease Control and Prevention, while pausing vital life-saving programs run by the US Agency for International Development. Now, these decisions send shockwaves across the world. For decades, the US has played a crucial role in some of the greatest health achievements in history: eradicating smallpox, nearly eliminating polio, tackling childhood malnutrition, tackling some of the biggest killers in the form of HIV, TB and malaria, and responding rapidly to emerging diseases with pandemic potential. And now, with this one decision, it has undermined global health security, weakened its own defences, and placed millions of lives at risk. The UK and our Commonwealth partners have long benefited from strong global health systems. When the world is healthier and more stable, we are too. But as a recent study in Public Health Challenges warned, the breakdown of global collaboration is as great a threat as any infectious disease. The US retreat forces us to confront this head-on.
On that point?
Yes, I'll give way.
Madam Deputy Speaker, can I commend the Honourable Gentleman for Winchester for bringing this forward? I don't think there's any of us in this House on either side of the chamber aren't concerned about what the prospects of it are. But when we live with reality, the member, of course, the Honourable Member will be aware of the withdrawal of the US from the World Health Organization. It's essential that lines of communication, even yet, regarding global health issues remain open and consistent. So does the Honourable Gentleman Member not agree that we must be proactive in establishing a new method of cooperation and information share as a matter of urgency? I think that's what he's looking for, and if there's going to be somewhere in between where we can meet, then perhaps maybe that might be the way forward.
I thank the Honourable Member for his intervention. That's a hugely important point. Madam Deputy Speaker, while economic pressures demand efficiency, let there be no doubt, withdrawing support from the World Health Organization is a false and dangerous economy. By stepping away instead of seeking reforms from within, the US has thrown global health security into turmoil. Now, this isn't just about principles, it is actually about consequences. A withdrawal of this scale damages health diplomacy and erodes trust. It allows adversarial states to step in, using disinformation and strategic influence to reshape the global health landscape to their advantage. If the World Health Organization is weakened, its ability to track, contain and fight disease is also weakened, and that makes us all more vulnerable. And other nations are already considering following suit. Argentina has voiced similar intentions, and if more countries withdraw, we risk a domino effect that could collapse the very framework we rely on to monitor and respond to health threats.
Will the Honourable Gentleman give way?
Yes, I'll give way.
I thank the Honourable Gentleman for his powerful speech. And does the Honourable Gentleman agree with me that one of the lessons from the pandemic is that the last thing countries should be doing is withdrawing from organisations like the World Health Organization and reducing international cooperation, given the risk of a future pandemic at some point?
I couldn't agree with my honourable friend more. You are completely right. And the World Health Organization is at the heart of international disease surveillance, coordinating early responses to outbreaks of deadly diseases such as Ebola, highly pathogenic avian influenza, both of which have been in the news in the last couple of weeks. In today's interconnected world, speed is everything. Without robust early warning systems, outbreaks that might have been contained could spiral into pandemics, just as my honourable friend has said. We also cannot ignore the worsening impact of climate change on global health. Now, diseases formerly classed as tropical when I was at university are now being seen in other parts of the world due to changing temperatures. and the US withdrawal from the Paris Agreement has already slowed efforts to tackle climate-driven diseases. Now its retreat from global health cooperation also leaves us even less better prepared to handle the consequences. So the UK must remain firm in supporting the World Health Organization's role in pandemic preparedness, not only because it's morally right, but because it is in our national interest. Madam Deputy Speaker, this crisis affects more than just emergency outbreaks. It threatens our ability to manage persistent health threats here at home. So if we take seasonal flu, every winter the NHS faces immense pressure from influenza, and our ability to develop effective vaccines depends on international cooperation, including data from US research centres. Now, if these partners are disrupted, how will we prepare for a 2025 flu season? The same applies to broader scientific research. The UK and the US have worked closely on One Health initiatives, studying how animal, human and environmental health intersect. Hundreds of these projects have now stalled, cutting off vital knowledge that could have helped us understand future pandemics. And we must explore ways to sustain these collaborations. That includes securing funding for key research programs and ensuring that our world-class universities remain engaged in global health security efforts. If we don't, we risk falling behind in disease surveillance, vaccine development and pandemic preparedness. Madam Deputy Speaker, I have spoken in this House before about the urgent threat of antibiotic-resistant infections in the NHS. Alongside the UK, the US has been a strong supporter of World Health Organization-led efforts to tackle antimicrobial resistance, an issue that experts warn is one of the greatest global health challenges of our time. Antibiotic resistance does not respect borders. Drug-resistant bacteria and fungi travel with people and goods across the world. Without global surveillance, the consequences will be dire. More people will die in NHS hospitals from infections that we can no longer treat. Now, this is not a distant problem, it is happening now. The UK has been helping Ukraine tackle antimicrobial resistance worsened by war. Despite severe funding challenges, collaborations between the Chelsea and Westminster Hospital, the Great Ormond Street Hospital, University College London and Ukrainian institutions have made progress. And this proves that even in difficult circumstances, proactive partnerships can make a difference. We must apply these lessons to protect our own health security. And I'd just like to pay tribute to the laboratory team and Professor Maida Kim in our hospital in Winchester, because they're helping lead the national efforts tackling antimicrobial resistance in our NHS. Madam Deputy Speaker, the UK has a proud history of leading in global health, because it is here that Sir Alexander Fleming discovered penicillin, revolutionising modern medicine. Edward Jenner's smallpox vaccine, it laid the foundation for immunisation efforts that have saved hundreds of millions of lives. And British researchers helped eradicate rinderpest in cattle. That is the only other disease besides smallpox to be wiped out completely. Today, smallpox is gone. Rinderpest is gone. One day, we hope to say the same about polio, but that vision is now at risk. And I was recently visiting the Rotary Club in Winchester, and I was learning about the long involvement of the Rotary Clubs worldwide in supporting polio eradication over a period of many years. The US withdrawal forces us to consider how we reaffirm our leadership in global health. Yes, I'll give way.
I thank my honourable friend for giving him way. Would he agree with me that that Nelson Mandela, and again 20 years ago today, he stood in Trafalgar Square waging a war on poverty, and as you will know, he was also the first chair of Gavi, the Global Alliance of Vaccine Inoculations, which had inoculated more than 1 billion children and saved 80 million lives. So would he agree with me that the government must fulfil its commitment as the Labour government and not fall behind our commitments to Gavi, as even the Conservative government said they would, fund Gavi properly, because Mandela's life reminds us, does it not, that the great victories are often in times of darkness like they are today.
I thank my honourable friend for that intervention. You are completely right on that very, very important organisation, which I will come on to, but we cannot highlight the impact that Gavi has had enough. Madam Deputy Speaker, the World Health Organization must adapt. This crisis highlights the need for a more resilient system, one that does not depend so heavily on any single nation. The UK must lead efforts to strengthen the World Health Organization by broadening its funding base and encouraging greater collective responsibility among member states. At the same time, we must invest in our own global health capabilities. This means strengthening research funding, protecting key collaborations, and engaging with middle-income nations to forge new partnerships. Global health security is not just about pandemics, it is about economic stability, national security, and long-term well-being of our people. And let us be absolutely clear. Disease does not respect national borders. A threat anywhere in the world is a threat to the UK. If polio still exists anywhere, it is still our problem. If antibiotic resistance is surging in one part of the world, it will reach our hospitals. And if a new pandemic emerges in a distant country, it will be on our doorstep faster than ever before. When it comes to global health, nobody wins unless everybody wins. Now, these are the words of Bruce Springsteen, but they apply as much to public health as they do to any other struggle. If we allow global health systems to weaken, if we turn our backs on international collaboration, we are not just failing others, we are failing ourselves. But Madam Deputy Speaker, this is also an opportunity. The UK has had a chance to lead the world in global health innovation while strengthening our economy. We have significant human capital available through our universities, businesses, learned societies and research institutions. And if we invest now, we can become a global hub for public health expertise, vaccine development, artificial intelligence and cutting-edge medical research. We should also remember the power of our capacity to offer education and training as cost-effective interventions. We can export solutions, shape international policy, and create high-skilled jobs right here at home. Now, the previous government, they saw universities as a battleground for cultural wars. We must see them as engines of innovation, global collaboration, and economic growth. They should not be political footballs. They should be powerhouses of discovery, opportunity, and progress. If we get this right, we won't just be protecting global public health, we will be securing Britain's place as a leader in the industries of the future. Madam Deputy Speaker, the US has made itself in the world weaker. The UK now has a choice. We can watch as global health security unravels, or we can take decisive action to lead, collaborate, and strengthen the systems that keep us safe. With the UK's aid budget being stretched thin, not least by the diversion of funds to cover domestic asylum costs, there is the growing concern that our leading contributions to the work of the Global Alliance for Vaccines and Immunisation that my honourable friend mentioned could be significantly reduced. Work that has vaccinated over 1 billion children, over half the world's children, and supports cutting-edge efforts to tackle major disease causes of death like malaria. So I ask the Minister, how can we justify cutting support to an organisation that has saved over 18 million lives? And will the government commit to restoring the overseas development aid to 0.7% of GDP to ensure life-saving initiatives such as Gavi and other key World Health Organization initiatives can remain viable? Because this is not charity, this is global health security, preventing outbreaks before they spread, reducing suffering and strengthening healthcare systems in some of the world's most fragile regions. Madam Deputy Speaker, this is a question of national security, moral responsibility and economic opportunity. And I urge this House to ensure that the UK does not waver in its commitment to a healthier, safer and more prosperous and secure world. Thank you.
Before I call the Minister, can I just remind members that when referring to you, it is actually the Chair. Minister Anneliese Dodds.
Thank you very much indeed, Madam Deputy Speaker. And I'd really like to thank the honourable gentleman for securing this debate on such an important topic. I'm very grateful to the other members who are here in the Chamber this evening. This government, of course, is aware, Madam Deputy Speaker, of the initial implications of the US government's decision that is the subject of this debate. The fact that there has been that initial decision to pause the US government's overseas financial assistance while it undertakes a review, including where this is accompanied by stop work orders. We are, of course, monitoring these impacts closely through our diplomatic missions overseas and with our other international partners. Of course, decisions on US policy are a matter for the US government. I know the honourable gentleman is well aware of that. We welcome the news that emergency food aid and life-saving humanitarian assistance should be exempt from the pause during the review period. And I would point out to members that these are early days for the new administration, and it wouldn't be appropriate, of course, and I know members wouldn't expect us to do this, for us to give a running commentary on each announcement and executive order that's issued by the US government. Members of this House will, of course, know that the US has a strong track record in global health and international development, and we have enjoyed close bilateral cooperation with them in pursuit of our shared objectives in this area. And I was really pleased to hear the honourable member for Winchester rightly referring to that collaboration. Of course, naturally, we're very keen for that to continue. For our part, this government is committed to working with others through genuine, respectful partnerships with donors, he mentioned a number of them, multilateral organisations and countries across the global south. So we maximise our impact at home and overseas. This is an important part of how we fulfil every government's first responsibility to keep people safe, and he was right to refer to security in the context of this debate. Also, of course, it's important for pursuing this government's guiding mission, which is to grow the economy and bring opportunity to people in our country as well, and to make progress towards our shared global goals for sustainable development during this decade. Now, our work on global health is absolutely crucial, and since I took up my role, Madam Deputy Speaker, over now 6 months ago, I've been making that case for action right around the world, from my visits to some of the countries most affected by some of the diseases in particular that he talked about, to major global summits. Currently, of course, he'll be aware that we are in the middle of a spending round process, so I'm not in a position to outline specific investment plans, and I know that he wouldn't seek to encourage me to do that, but I do want to reassure members that this government will be at the forefront of international work on improving global health as a priority for our country. This is the right thing to do, as he articulated, and it's a smart thing to do, as he said, of course, as well. No country can thrive if its people can't thrive. In today's interconnected world, we've all seen the impact of shocks in healthcare and in communicable disease ripple right around the world. Of course, we saw that with the COVID-19 pandemic above all, harming our health in the UK and right across all of our economies globally. Deadly diseases, to use his phrase that he kept repeating, and he's right to do it, deadly diseases do not respect borders, nor, of course, does antimicrobial resistance, which he rightly pointed to as another major challenge for us in global health terms. They threaten us all, and it takes a concerted international effort to tackle them. So we are working with countries around the world to help them develop the systems they need to tackle the health threats they face. Yes, very happy to.
Can I thank the Honourable Lady for a very comprehensive response to the Honourable Gentleman who has set the scene very well. In my constituency of Strangford, I think of the church groups, in particular I think of the Elim missions, who have a very constructive and positive strategy for Zimbabwe, for Swaziland. And Swaziland, as an example, the numbers of those who have AIDS is at almost epidemic levels. But one of the things that the West is able to do, and the USA and the UK and others, is to provide the medications that can preserve life, number one, can help people to live longer than they ever have. And that happens because of what government does, but it also happens because of what the churches do. And I'm wondering, as the Honourable Lady, because she's always very helpful in her responses, is that something that maybe government could look at in a way to see, work closer together with the churches and use them and use each other perhaps to make lives better?
Thank you, Madam Deputy Speaker. I'm really grateful to the Honourable Member for Strangford for that really important point. Of course, his kind words as well. He's right to pay tribute to the incredible civil society that we have working on these issues right across the United Kingdom. He referred to church groups, the important work that they do with communities affected by, for example, HIV/AIDS, other diseases as well. I was really pleased to hear the Honourable Member for Winchester talking about polio as well and the role of the Rotary Group in seeking to combat polio. And I've been absolutely delighted to be working as a polio champion with some of the organisations campaigning on this, particularly the global programme to eliminate polio. I do think it's really important we seek to work together on these issues, and we're reviewing our strategy towards civil society. I'll make sure this issue about health activism is fed into that process. I do think that's really important because we do need to make sure we are facing up to those ongoing threats and doing so together, Madam Deputy Speaker. And of course, the Honourable Member talked about threats from communicable disease being intensified by the climate crisis and environmental degradation. He was right to do so. But also, of course, we see non-communicable disease becoming more frequent in many countries in the global south. And of course, there's still that potential threat from pandemics too. We're also, Madam Deputy Speaker, working with others to champion sexual and reproductive health rights and freedoms for all, including, as a key part of our work, to empower women and girls. We're investing in global health work that we know provides excellent value for money, reaching millions of people and maximising the impact of every single pound that we put in. And I was really pleased to hear Gavi mentioned by the Honourable Member, also by the spokesperson on the opposite benches who has so much expertise internationally as well. Our support to Gavi, that Global Vaccines Alliance, is enabling it to immunise 300 million children and save up to 8 million lives from vaccine-preventable diseases over 4 years. That support for Gavi, for that multilateral and engaged action internationally, is clear, and I set that out at the International Development Committee. I won't repeat it here for reasons of time, Madam Deputy Speaker. Similarly, of course, since 2002, the Global Fund to fight AIDS, TB and malaria has saved over 65 million lives and reduced the combined death rate of the three diseases by 61%. The UK has played a significant role in this success. UK's support also to the Child Wasting Innovation Programme has helped it raise financing from others as well, enabling treatment for 850,000 children. And here the multilateral architecture, of course, is also critical, and I was really pleased to hear him underline the importance of the World Health Organization as well. The UK will remain a strong supporter of the World Health Organization. We recently announced new funding. Hopefully he saw that. There was new funding to the WHO in support of its delivery and transformation agenda. We'll continue to work closely with the WHO and its member states to strengthen the organisation so it can help countries to meet the health challenges of our times. Now, Madam Deputy Speaker, the UK's National Risk Register estimates an up to 25% probability of another pandemic in the next 5 years. This is one of the reasons why we remain committed to seeking to secure a pandemic accord at the WHO. Getting better at preventing and preparing for pandemics matters immensely, of course for global health security, but also for UK health security and this government's mission to build a national health service that's fit for the future. The same applies, and he was right to talk about this, to the threat of antimicrobial resistance as well. Already, we're seeing thousands of deaths in the UK which are attributed to antimicrobial resistance. And I was really pleased to hear about the work of Dr. Maya De Kim at Winchester University. I'm also extremely proud, Madam Deputy Speaker, of the work of Sally Davies on these issues as well, working with the UK Government and Lord Darcy as well. The UK Government worked really hard to agree an ambitious global set of actions against AMR at last September's high-level meeting dedicated to that subject, and we'll keep driving that work forward. Now, before I wrap up, I want to shine a light on the wider work of the UK's world-class scientists and public health and medical institutions. Harnessing the huge wealth of talent and expertise here in the UK is fundamental for the new modern approach to development that this government is adopting. The UK's scientists do a huge amount to address global health and development challenges, advancing our understanding of disease, pioneering work in genomic medicine and developing novel vaccines. I was really delighted to hear the passion with which the honourable gentleman talked about this, and I've seen for myself the immense ambition of labs here in the UK. Like the Jenner Institute, please forgive me, Madam Deputy Speaker, if I smile, because I'm very proud to represent the constituency within which the Jenner Institute is based. I visited them recently. And British scientists, of course, have helped develop 2 malaria vaccines which have the potential to share millions of lives. Thanks to the expertise and billions of British scientists, the dream of eradicating malaria looks increasingly possible. And the honourable member quoted Bruce Springsteen. Well, I have to say that I hope the glory days of those scientists will be yet to come when we do finally globally eradicate malaria. And if we manage to do so, it will be because of those incredible efforts. Again, of course, we talked about Gavi earlier, Madam Deputy Speaker, and with our support as the UK, Gavi plan to roll out these new vaccines to 25 countries this year. Our health, life sciences and pharma sector is second only in value to that of the US. They have an annual turnover of £50 billion, with £25 billion a year in exports, and they support 115,000 high-value jobs, which you rightly referred to. I just want to finish, Madam Deputy Speaker, by saying how proud we can all be of the work that our country does on global health. It's good for us here in the UK, it's good for people across the globe, and it's a key part of how we make sure as many of us as possible can keep working together in partnership towards the safer, healthier, more prosperous world that people everywhere want to see and that they deserve. Thank you, Madam Deputy Speaker.
The question is that this House to now adjourn. As many as are of that opinion say aye. Aye. The ayes have it. Order, order.